Skipping warm-ups sounds harmless until it isn't. You might think, I'm just going for a walk, or it's only gardening, and you jump right into it. But here's the thing. Your knees don't just wake up instantly ready for action. They need a little heads up, especially as we age. Warm-ups are like opening the curtain slowly in the morning. You don't want to blast the light in all at once. Your cartilage, ligaments, and tendons, they need that same gradual wake-up to move smoothly, absorb shock properly, and avoid injury. Let's break down why skipping warm-ups is quietly sabotaging your knees. When you start any movement cold, your joint fluid called synovial fluid isn't circulating well yet. That fluid is like WD-40 for your knees. Without it, movements feel stiffer, and the cartilage gets more wear and tear. Over time, that grinding leads to micro damage you don't feel right away. But trust me, it's adding up. Warming up also raises your body temperature, which increases blood flow to your muscles and joints. That's when everything moves more fluidly, with less friction. Think of it like warming up honey. It pours better. When you're over 60, your body doesn't regulate temperature or blood flow as efficiently as it used to, so warming up isn't optional. It's a must. And yet, many seniors skip it, either because they don't know the benefits or they feel like it's too much trouble. But what's really more trouble, 5 minutes of gentle movement or months of aching knees. Even just walking in place, slow leg swings, or easy chair squats can count as a solid warm-up. You don't need fancy equipment or a gym. What you need is consistency. You're not prepping for a marathon. You're prepping to protect your knees from taking the brunt of daily movement unprepared. You might be thinking, but I don't feel stiff. Do I really need to warm up? Yes. The key is not waiting until stiffness shows up. Think of a warm-up as insurance. When you do it right, you may never feel the damage you've prevented. Now, I know some people believe their body just doesn't need it. But the truth is, knees that feel fine now could be hiding years of slow erosion. Once that erosion crosses the pain threshold, it's much harder to reverse. Prevention is always easier than repair. Let's also not forget balance. A proper warm-up primes your coordination and stabilizer muscles. It makes you less likely to stumble or twist something when you least expect it. That's not just good for your knees. It's a safety net for your whole body. I've seen people recover from knee surgeries and swear by their physical therapy routines, only to ignore warm-ups again once the pain goes away. But pain-free doesn't mean problem-free. In fact, it's often the silence before the storm. If you've had knee issues before, warm-ups aren't just a suggestion, they're your defense line. So here's the truth bomb. Skipping warm-ups is a knee pain time bomb with a ticking clock. The best way to diffuse it? Add 5 minutes of mindful movement before you do anything physical. Yes, even vacuuming. Yes, even walking to the mailbox. Because knees don't care how small the activity is. They care whether you prepared them for it. By now, you might be wondering, okay, what exactly should I do for a warm-up? Don't worry, we'll get to that. But first, we need to understand what else is silently making things worse. Over-relying on braces might feel like the safe thing to do, especially if your knees feel unstable, sore, or just plain tired. I get it. A brace offers that immediate sense of support, like someone holding your hand while you walk. It feels comforting. But here's the problem. The more you lean on that support, the less your own muscles and stabilizers get involved. And when they're not involved, they shrink, they weaken, and they eventually check out. You see, the body is brilliant at adaptation. If a joint is supported externally for too long, it takes that as a signal. I guess I don't need to work here anymore. Your quadriceps, hamstrings, calves, and even your glutes start losing engagement. And that means the very muscles that should be protecting your knees are clocking out early. Over time, this leads to more instability, not less. It's like constantly walking with a cane when you don't really need one. Your body stops trying to balance itself. Same thing with a brace. It becomes a crutch, literally and figuratively. And it's sneaky too. You might wear it just for a long walk. Then suddenly it's on during chores, trips to the store, even sitting around the house. Before you know it, you've trained your knees to depend on it. Now, this doesn't mean braces are the enemy. Far from it. In short bursts or after an injury, they can be lifesavers. But the key word is temporary. If you're still wearing a knee brace 6 months after a fall or strain, it's time to ask why. Is it helping? Or is it quietly robbing you of your muscle power? Let's talk about balance and proprioception. These are your body's natural GPS and shock absorbers. When you wear a brace all the time, your knees stop getting feedback from the environment, how the ground shifts, how your weight moves, how your body reacts. That disconnect leads to slower reactions and higher risk of falls. Yes, braces feel like they're protecting you, but in reality, they may be doing the opposite over time. You might be saying, "But without it, I limp," or "I'm afraid of the pain returning." That's valid, but fear is not a strategy. You can and should retrain your body to support itself. That starts with reactivating the muscles that have gone dormant. Gentle strength training, balance drills, even walking on uneven surfaces can help rebuild that lost capacity. Your knees are capable of more than you think. They just need a chance to remember how to work again. Another hidden side effect: wearing a brace too often can alter your gait. It changes how you walk, which puts stress on other joints, like your hips, ankles, and even your back. That cascade effect creates a bigger mess than you started with. One little brace used incorrectly can lead to compensation patterns that affect your whole body. And here's something you might not have considered: the mental trap. The more dependent you become on the brace, the more you believe you need it. That belief becomes a habit, and habits shape your future. If you start building your day around what the brace allows you to do, you're surrendering control. You're letting fear and habit dictate how you live. Let me be clear again. I'm not saying never use a brace. I'm saying don't let it become your new knee. Use it as a bridge, not a destination. It's there to help you cross a short-term challenge, not to carry you forever. So ask yourself, if you didn't wear the brace tomorrow, what would you need to strengthen to move confidently? That's where the focus should shift. That's where real, long-term protection lives, not in a neoprene sleeve, but in the power of your own body. You remember the warm-up lesson, right? Well, this is the next evolution, reawakening your support system, because a brace might hold your knee, but it'll never build it. Powering through painkillers is one of the most common and most dangerous mistakes seniors make when dealing with knee pain. At first glance, it seems like a simple solution. Pop a pill, feel better, keep moving. No harm, no foul, right? But the truth is, this approach is like turning off a smoke alarm without putting out the fire. The danger is still there. You're just not hearing it anymore. Here's the deal. Pain is a messenger. It's your body waving a red flag saying, "Hey, something's wrong down here." When you take painkillers, especially regularly, you silence that warning. You might feel capable of doing more, going for longer walks, climbing stairs faster, lifting heavier groceries, but you're not fixing the issue. You're just ignoring it. Now that might work for a while. You feel like you're winning. But what's really happening is that you're pushing through inflammation, joint stress, or cartilage damage without addressing the root. And the longer that goes on, the worse it gets. Painkillers might hide the symptoms, but the cause is still chipping away at your joint health behind the scenes. And it's not just about the knee. Painkillers, especially NSAIDs like ibuprofen, come with a price. Long-term use can increase your risk of stomach ulcers, high blood pressure, kidney problems, and even heart issues. For seniors who might already be juggling multiple medications, that's a dangerous cocktail. And if you're using them daily just to get through, you're not managing pain, you're masking it. Let's not forget the psychological trap. Painkillers create a false sense of security. You think, if I don't feel pain, I must be fine. So you skip the warm-ups, avoid physical therapy, or ignore stretching routines. All the while, the underlying mechanics of your knee are falling further out of balance. Remember earlier when we talked about how relying on braces weakens your stabilizers? Painkillers have the same effect, but mentally. They lull you into a pattern of avoidance, where you stop listening to your body, stop adapting, and stop actively participating in your own healing. That's a problem. Let me share something important here. Not all pain is bad. Some discomfort is part of growth, strengthening, healing. The key is knowing the difference between good pain, like the ache from rebuilding muscle, and bad pain, like sharp, stabbing joint pain during movement. If you're using painkillers to block bad pain, you're skating on thin ice. So what's the alternative? It starts with being curious about your pain instead of afraid of it. Track when it shows up, what triggers it, and what makes it better. Use that as data. Then focus on natural anti-inflammatory strategies, turmeric, omega-3s, joint-supporting foods, gentle movement, physical therapy. These don't suppress the messenger, they help address the cause. And yes, there's a time and place for medication. If your doctor prescribes it post-surgery or during a severe flare-up, follow that guidance. But long-term daily use without a plan, that's where the trouble brews. I want to leave you with this thought. Pain is not your enemy, it's your ally. It's there to help you navigate, to tell you when something needs attention. Treating it with respect rather than silencing it gives you power. It puts you back in the driver's seat of your health, not just along for the ride. You've already learned how warming up protects your knees and how braces can both help and hinder. Now you know painkillers, while useful in moderation, can become a trap. And next, we're diving into something you might never expect to affect your knees. But it does, more than you think. Neglecting hip and ankle strength might sound like it has nothing to do with your knees, but let me tell you, they're all part of the same chain. If one link in that chain is weak or unstable, the stress gets dumped somewhere else. And guess where it lands? Right on your knees. Think of your body as a 3-story building. The hips are the top floor, the knees are the middle, and the ankles are the foundation. If either floor above or below has a structural problem, the middle gets squeezed, twisted, or misaligned. So when your hips are weak or your ankles don't move well, your knees get forced to take on jobs they were never built to handle. Let's start with the hips. Your glute muscles, gluteus medius and maximus in particular, are responsible for stabilizing your pelvis, keeping your legs aligned, and absorbing the impact when you walk, stand, or climb stairs. When those muscles are underdeveloped or lazy, your knees cave inward. That's called valgus collapse, and over time it destroys cartilage and puts nasty pressure on your ligaments. Translation: hello, chronic knee pain. You might not even notice it at first. But subtle things like your knees knocking together when you stand up or your foot turning out while you walk, red flags. That's your body compensating for weaknesses elsewhere. And every step you take like that adds more micro-trauma. Now the ankles, they're your shock absorbers. When they're stiff, locked, or weak, they can't absorb impact properly. That impact travels upward right to your knees. Plus, ankle stiffness changes your gait. Your foot might roll in or out. Your stride shortens, or your heel lift gets sloppy. And just like that, your knees are caught in the crossfire. The sad part, most people don't even think to train their hips or ankles unless a physical therapist points it out. They'll stretch the hamstrings, maybe do a quad extension or two, but they ignore the deep stabilizers, the unsung heroes of pain-free movement. Let's fix that. For your hips, exercises like standing side leg raises, clamshells, or glute bridges work wonders. Focus on slow, controlled motion, not big, flashy moves. Your goal is to reawaken those sleeping muscles. Feel the burn where it's been quiet for too long. For ankles, try heel raises, ankle circles, or standing on one foot to build balance and mobility. Even rolling a tennis ball under your foot for a minute helps loosen tight fascia that affects how you walk. And here's a little trick. Walk barefoot more often. It strengthens your feet, improves proprioception, and forces the ankle to stabilize naturally. Of course, be smart about it. Start on soft surfaces like carpet or grass. Safety first. One more thing, your posture matters. When your hips and ankles are weak, your posture shifts forward. That puts extra pressure on the front of the knees, especially when standing or walking. Fix the base and you realign the entire structure. This isn't about aesthetics. It's not about toned glutes or flexible feet. It's about redistributing the workload evenly so your knees aren't the scapegoat for everything else. Think back to what we've talked about so far. Warming up, avoiding brace dependency, not masking pain. Now we're completing the circle by making sure the rest of the kinetic chain is pulling its weight. Because the truth is, your knees can only do so much on their own. They need backup. They need coordination. They need hips that guide and ankles that absorb. When that system works together, the knee can finally breathe easy. And once you've got that foundation solid, then and only then should you move on to exercises. But not just any exercises, because that's our final chapter, and it's a big one. One-size-fits-all exercises might be the biggest trap of them all. You've probably seen them, those generic routines for bad knees or seniors over 60 floating around YouTube, printed in handouts, or even casually recommended at the doctor's office. They seem harmless enough. A few stretches, some seated leg lifts, maybe a wall squat or two. But here's the issue. Your body isn't generic. Your knees have a unique story, and cookie-cutter movements often ignore what your joints are trying to tell you. Let me ask you something. Have you ever done a knee exercise and felt worse afterward? Maybe it didn't hurt in the moment, but later that day the joint felt swollen or oddly tight? That's not your imagination. That's your body saying, "This isn't right for me." And that feedback matters. You see, most of those exercises are based on what works on average, not what works for you. They often fail to consider your muscle imbalances, past injuries, gait mechanics, or flexibility limitations. So while you're faithfully doing those leg extensions or squats, you might be unknowingly reinforcing the very patterns that caused your pain in the first place. Let's break this down. Imagine someone with tight hips and weak glutes doing a wall squat. Looks fine from the outside, but because the glutes aren't firing, their knees collapse inward, putting more strain on the joint. Or take someone with poor ankle mobility trying to do a deep lunge. Instead of the ankle bending properly, the knee shoots forward and bears all the pressure. These might look like solid knee rehab exercises, but they're accidents waiting to happen if you don't tailor them. That's why personalization matters. Before any exercise becomes a habit, you need to understand your movement patterns. Do your knees track straight when you walk or squat? Are your hips compensating for your ankles? Is one leg stronger than the other? A few simple assessments, like doing a sit-to-stand from a chair or standing on one leg, can reveal imbalances that generic workouts totally miss. This isn't to say those exercises are bad in theory. They're just incomplete. Used with awareness and proper form, they can be useful building blocks. But used blindly, that's how setbacks happen. And for seniors, setbacks can mean more than just a little soreness. It can mean months of pain or another trip to physical therapy. So what's the smarter approach? Start with simple, slow, mindful movement. Quality over quantity. Feel how your knees respond. Don't just check boxes, check in. And don't be afraid to swap an exercise that doesn't feel right for one that gently challenges you without strain. For example, instead of deep lunges, try partial chair squats. Instead of straight leg raises, try resistance band kicks with a small range of motion. Here's a secret many rehab pros use. Focus on control, not effort. The best joint-protecting exercises are often the slowest, most boring-looking ones. They teach your body to stabilize, align, and communicate better. That's what keeps pain away, not the number of reps, but the precision behind them. And if you're not sure where to begin, that's where working with a physical therapist or movement specialist can be game-changing. Even just a few sessions can help you identify what your knees need and how to safely build strength from the ground up. You've come a long way in this journey, understanding the dangers of skipping warm-ups, overusing braces, ignoring pain signals, and forgetting the importance of your hips and ankles. This final piece? It's about honoring your individuality. Your knees are yours alone, and they deserve better than a recycled workout pulled from the internet. So before you follow another Top 5 Moves for Seniors video, pause. Ask yourself, is this right for my body today? If it's not, that's okay. Adapt, shift, choose smarter. Because when it comes to joint health after 60, doing less but doing it well isn't weakness. It's wisdom. Let's take a moment to slow down, breathe, and really let this sink in. Your knees have carried you through a lifetime of movement, through the big adventures and the tiny daily steps you've taken without even noticing. And now, more than ever, they're asking for your attention, not through shouting or drama, but through whispers. A little stiffness in the morning, a twinge when you rise, a hesitation on the stairs. What you've just learned is more than a list of do's and don'ts. It's a deeper understanding that your body isn't betraying you, it's just trying to adapt. And sometimes those adaptations turn into habits that quietly chip away at your strength, your confidence, your freedom. But the good news? You have the power to rewrite that story. When you stop skipping warm-ups, you signal to your knees that they're worth preparing for. When you wean off the brace, you invite your muscles back into the conversation. When you listen to pain, not fear it, you build trust with your body. And when you stop settling for generic fixes, you step into the wisdom that comes with experience, that healing isn't about intensity, it's about attention. No matter where you are in your journey, just starting out, recovering from injury, or simply wanting to keep moving with ease, know this: small shifts create lasting change. Your knees don't need perfect. They need consistent care, gentle awareness, and a little patience. So the next time you stand up, walk, or bend down, do it with intention. Know that every thoughtful movement is a message back to your body. I've got you. I'm listening now. Your knees are listening too, and they're ready to meet you halfway.